Cristo, mi Señor. Para Él será la honra y la gloria, mi Señor. Crucificado estoy con Cristo, mi Señor. Para Él será la honra y la gloria, mi Señor.
Equiscript's cause is to expand access to health care in the communities that we serve. When we met the folks at OneWorld Health, we knew instantly that we had found a great organization to partner with.
OneWorld Health, we exist to provide quality, affordable care to communities in need. I think there's a lot of organizations that do incredible work out there, and there's a real need for what we would call relief work in the medical space. But there's not a lot of organizations that look beyond that relief period, and that's really where we want to come in.
Last December, we were approached by OneWorld Health with an opportunity to sponsor an ultrasound machine.
Mike and Stephen over at Equiscript, we reached out to them with the opportunity. They were incredibly gracious.
My business partner and I, Stephen Kerr, talked about it and decided we thought it was a really good way to promote community health.
It really started the conversation for what we were doing and the impact that we were having in Nicaragua and Uganda. And Stephen and Mike both had the opportunity to take their families down to Nicaragua and really see what we were doing.
We were able to come down last August and actually see the machine in use. And we were able to see a mother who saw her child for the first time, and her eyes just lit up. And so the cost of that machine was repaid really in that look in her eyes. We knew that we had a lot of clients who were dedicated to community health. We were trying to kind of tie together how we would introduce our clients to OneWorld Health, and we decided we had to start something, and so we decided we were going to sponsor 10 people to go on a mission trip to Nicaragua.
Hi, my name is Karen and I am a registered nurse.
Hey, my name is Katie Turner and I work at a federally qualified healthcare center in Georgia.
Hello, my name is William Worrell. I'm the CEO for United Medical Centers. We are a federally qualified health center that partners with Equiscript.
Hi, I'm Stephen McCall. I'm a doctor at the Waco Family Health Center. It's an inner city community health center in Waco, Texas.
My name is Catherine Rubin, and I'm very happy to apply for this opportunity to volunteer with Equiscript.
This is my video application for the OneWorld Health Equiscript mission trip in December.
I'm working really hard to learn more Spanish before I go.
I already have my passport in hand. I was also speaking to Mike, and I had goosebumps on my arm telling him how excited I was for this opportunity to go to Nicaragua.
I'm Sharon Chandler from Central Virginia. I know that holding a hand, smiling, and hugging someone often is better medicine than pills and Band-Aids.
Say that the main problem with little boys is because of mosquitoes.
What's so beautiful is to watch people use their gifts and deploy them here so incredibly directly. I mean, to take care of patients, to communicate with patients, and just to watch them do what they are gifted at doing.
I had a child, 8 years old, who came in really sick. He had an opportunistic infection. That opportunistic infection got complicated by both dehydration and a secondary respiratory infection. And it put him at grave risk for death. We got him into emergency services and on to Managua, which is where the Children's Hospital is. We got both his infectious disease and his hydration needs met, and we got a safe and secure transport. The weirdest thing about it, though, is that we set up shop yesterday. If we had a clinic the next day or the next day, might she have waited 2 more days or 3 more days? So had we not been there that day, they may have waited and the kid may have been far more ill and not made it. I was happy to be there at that point in time.
reality of life is really tough in Nicaragua. About 35 to 40% of the population lives on about $2.50 a day. But it's certainly not without hope. The people are beautiful and gorgeous and have an incredible joy for life.
This organization has come to Nicaragua to change many people's lives. People take their time, their resources, and the knowledge to come down to the country to share what the Lord has provided for them. So we appreciate your effort and we thank you with all our heart in the name of all the Nicaraguan people.
The thing that's so appealing to me about OneWorld Health is that they're providing sustainable health care. Community-based sustainable health care. In 5 years, we hope that we will have been able to introduce OneWorld Health to community health centers throughout the country. I think so very highly of community health centers and would like their knowledge to be able to transfer to OneWorld Health, but also so the providers that are working in the U.S. can come here and learn more about where many of their patients' families have come from and the environments that they live in. If you really want people to follow you, you got to lead. And you got to lead with your heart and you got to lead by example. And a way to show that it's where your heart is to actually put your money there and your time and your resources. And that's what we're putting towards this particular mission trip. It'll always be a very important part of our company.